Welcome to another episode of Absolute Talks with Jack and Conrad. I'm Conrad.
I'm Jack. In this episode, I'm very excited to announce the availability of our latest protocol manual, A Clinician's Guide to Modern Removable Workflows and Materials.
The initial excitement that came with the promise of digital dentures unfortunately failed to meet expectations. I'm so happy to say that we're finally at a place where modern day materials and polymers are allowing us to not just produce extremely strong but very aesthetic products.
Like with most new clinical workflows, comes advantages, but also questions and uncertainties. Conrad, tell us a little bit more about the protocol manual itself.
Yep, so I wrote this protocol manual in an attempt to answer the clinical workflow questions as well as the archiving questions and the material concerns we've received over the last few years.
Will you also talk more about the Forever denture, the Absolute branded denture?
So we decided to get away from digital dentures because of the stigma associated. So we call our Absolute denture a Forever denture. Obviously, nobody can claim that a denture will last forever. But our tagline, Your Forever Smile, kind of sums up the advantages of this process. Once we have your smile archived, we can easily retrieve it, and that's an approved smile, and just duplicate that in the next process.
Oh, very nice.
So it's very easy for us to restore a new archived denture from the archived data.
Well, I've heard we can also capture an existing denture to help with future options.
Yep. Once we have this denture archive, it's very easy for us to produce a copy. Patients in assisted living or limited mobility that are happy with their dentures, we can take that denture, digitally archive it, and if they ever lose or destroy it, give us a call. Within 24 hours, we deliver an exact copy to the patient without clinical appointments.
So this means if a patient loses or destroys a well-fitting denture, we could basically create a brand new one?
Exactly. Brand new, same fit, same aesthetics, without a need of any more appointments.
Well, initially the printed denture materials were brittle. They weren't very aesthetic at all. They were actually terrible. What have you seen with the new smart polymers?
Not only is the smart polymer 3 times stronger than the ISO required standard, but it also comes in 5 tissue colors, which means our clinicians have all the resources available to restore these dentures. If you email us or contact Jack or myself, we will make sure we get you one of these shade guides.
Yeah, and the biggest question I receive on is workflows is, does a clinician need to learn a new workflow to restore a forever denture?
Biggest advantage here, no. You can do a traditional bite room workflow, or we can use the existing denture workflow, which allows us to restore a denture in 2 appointments.
Very nice.
So a lot of upgrades with this process.
Well, does the manual walk a clinician through the restorative process?
Most definitely. It's a very comprehensive workflow manual. So I called in the help of a very good friend of ours, Dr. Barry Franzen from Milwaukee Dental Implant Center. And we processed the case with him, and he documented all the steps involved with it. So if you have any questions, this protocol manual will definitely answer that.
Do you need an intraoral scanner to restore a forever denture?
Definitely not. It does make the process a little bit smoother, speeds it up a little bit. You can also use a benchtop scanner, or you can just send the reline denture to Absolute and we can do the digitizing for you.
Well, there's lots of information here. You can go ahead and download your very own protocol manual clicking on the attached link, or also don't hesitate to give us a call directly anytime, simple questions, or go to our website absolutedentallab.com and get your version of the protocol manual today.
Yep, and thank you for joining us for another episode, and stay safe, everybody.